And new data shows that West Virginia has seen some modest improvements in child well-being, but the state continues to lag behind its neighbors in several key ways. Our Chase Campbell has more on the latest statewide results from the Kids Count data book.
The Kids Count Data Book, released annually by the Annie E. Casey Foundation, tracks children's health, education, economic security, and family stability across the nation. The latest numbers have West Virginia ranked 41st overall, a slight improvement over previous years. The state saw gains in health insurance coverage for children and reductions in families living in high poverty areas. West Virginia Center on Budget and Policy Director Kelly Allen says these accomplishments are something to be proud of, but don't tell the whole story about the data.
We made some incremental improvements that are really something to celebrate. We saw a small decrease in the number of children who are uninsured and a few other improvements in family and community indicators. But we also stayed flat in a lot of areas. We have one of the highest rates of child poverty in the country. 1 in 5 children live in poverty. And we currently rank lower in children's well-being than any of our neighboring states.
Allen says much of the improvement seen in West Virginia can be attributed to increased federal funding during the pandemic years, funding which has mostly run out as of 2025. And with Congress considering big cuts to federal funding, how long the state can keep up those positive trends without outside support isn't clear.
Children in our state have seen some incremental progress. I think, yes, a lot due to federal investment, and that is at risk of backsliding if Congress makes sweeping changes to programs that help families put food on the table, get health insurance.
Allen says West Virginia receives about half its state budget from federal sources, significantly more than most states, making it especially vulnerable to any federal cuts. Allen says state lawmakers could help by investing in programs like child care assistance and state-level child tax credits, but says it would be difficult to fully offset the loss of further federal funding. Chase Campbell, WTAP News.